Okay, I just kind of want us to keep having church, but I know we got to get started, but that felt really good. Good morning, everybody. My name is Frankie Robertson, and this is my precious little daughter, Zoe Amandla, and we are happy to welcome everybody to Black Church Joy this morning. It is a celebration of all things maternal wellness, and we are so excited. I'm Frankie Robertson. I'm president and founder of the Amandla Group. It's a social justice consulting firm focusing on addressing the social and political determinants of health. And I am so happy to share this moderating space with Caitlin Joshua. I'm going to turn over to Caitlin to introduce herself this morning and to tell us a little bit about what we're going to do this morning.
Absolutely. So as Frankie stated, y'all super excited and blessed to be in this space with you guys. Caitlin Joshua with the Power Coalition for Equity and Justice, and we support everything Amandla Group does. And so once again, welcome this morning. We will be discussing the social and political determinants of health as it relates to Black maternal health, and we're going to dive right in.
Absolutely. Thank you, Caitlin, for joining. And just an FYI to everyone, you know, we are in the middle of a global pandemic, a very serious global pandemic. And in case there's anyone wondering why I am donning a mask in my own home around my precious 3-year-old daughter, is because earlier in this week, I was in a very public space amongst about 300 people that did not have on masks. And as just a precaution, I've chosen to wear this mask until I can take a precautionary COVID test tomorrow to make sure that I'm not unknowingly infecting my family, but I know God is good and I'm not claiming any of that. All is well. And we are following the science and following the guidelines. So the reason for this, but hopefully next time you see me, you can see my entire face, but I will do what I can do to protect my family. So thank you. So we are going to go ahead and get started this morning. We have some really phenomenal folks here that are truly experts in their field of wellness, maternal child health, just fatherhood advocacy, social justice. And I'm super excited to be able to partner this morning with two amazing organizations who I have just really the highest regard for and have always wanted to work with. Power Coalition for Equity and Justice. Absolutely. Power Coalition for Equity and Justice, and Sista Midwife Productions. So we're very happy to partner with them to bring this event to you today, Black Church Joy. Also want to recognize one of our sponsors for this event today, and that is going to be the Department of Children and Family Services through their partnership with the Pew Charitable Trust and their Calling All Sectors grant in conjunction with the Louisiana Department of Health and the Governor's Office on Women's Policy to make this possible, with support from the Truth Racial Healing Program with the Foundation for Louisiana. So very happy for them to help make this event possible. So we're going to go ahead and get started. We actually are going to start off, yes, you can, with several polls. And one of the things I want to do is just, you can, 10 plus 11 equals 12. I'm going to set the precedent with normalizing pandemic life. This is real life. My daughter's not in school. Presently, she is home and this is her space. And as a working mom, I try to normalize what this is like for everyone. So I appreciate your patience and I appreciate her patience with welcoming quite a few people in our home this morning via Zoom. So this is a team effort and she's going to be with us throughout this segment. So thank you all for embracing this new normal, because this is what it looks like. So thank you. So we are going to start off with a poll, and this is what do we know about healthy births? We are going to learn so much. Some of you all are coming into this conversation this morning about Black maternal and infant health, and some of us are here to learn more. So we want to know what you already know about Black maternal health. So if we can take about we'll take a few moments to answer these questions, and then you're going to see this poll again at the end. So take about 2 minutes, and then we will continue on. So, and I will share the results, and I'll be ending the poll in about a minute. 6 questions. What can impact a future pregnancy? If you have high blood pressure during pregnancy, you should schedule a checkup with your primary care physician once you have your baby. People who do not have diabetes or sugar, as some of us call it, prior to pregnancy are not at risk of developing diabetes during pregnancy. Preeclampsia is a type of sudden high blood pressure that occurs after 20 weeks of pregnancy and is often associated with high amounts of protein in the urine, which best describes the role of a doula. And depression can contribute to preterm birth. So I think we have a lot of folks who have chimed in already. So we're going to go ahead and close it out in 10. All right, let's end this poll. And I will share the results. All right. So we got a lot of folks who are knowing a pretty good amount about healthy births. And I hope that after this conversation is over, you have learned more and that there's a desire to learn more so that we can all work together as a part of the faith-based community, as a part of the community as a whole, to see what we can do to impact Black maternal and infant health. So thank you for participating in this poll. And now I will turn it over to Caitlin to introduce our speakers.
All right. And so once again, guys, super excited to have y'all on this webinar this morning. Let's jump right in with Miss Alicia Mingo. She is a faith outreach coordinator for SMP. She will discuss with us the state of maternal child health in Louisiana, IPV as a cause of maternal mortality, results from the Birth Story Project, and maternal morbidity. Take it away, Miss Alicia. Let's see. Is she frozen just for me, y'all?
No, she's frozen for all of us, so we'll give her a second, and
We'll
she's
give her a
share
second.
her screen. Yes.
No worries.
Healthy Birth Ambassadors through Sista Midwife Productions. I am married, I am a minister, and I attend Praise Temple Full Gospel Baptist Church here in Shreveport. And my husband and I serve as the executive directors of the family ministry. So it's just a wonderful place to be. And again, I am grateful for being a part. And if you'll give me just a moment, I'm going to share my screen and we will get started. All right, so I've already talked a little bit about myself. Oh, and I have 3 wonderful children. So what we'll do now is we're going to look at the numbers. We're going to look at some national, some regional, and some state data, of course. So I want to let you guys know a pregnancy-related death is the death of a woman while pregnant or within 1 year of the end of a pregnancy from any cause related to or aggravated by the pregnancy or its management. The maternal mortality rate is reported as the number of deaths out of 100,000 live births. And in 2018, the maternal mortality rate for the United States was 17.4 per 100,000 births. Women in the United States are more likely to die from childbirth or a pregnancy-related cause than women in other developed countries. That says a lot. Research suggests that half of these deaths are preventable, and in some cases, up to 80% are considered potentially preventable. So we're talking 8 out of 10, right? That's a really big number. So the risk of pregnancy-related deaths for Black women is 3 to 4 times higher than those of white women. And in fact, a Black mother with a college education is at 60% greater risk for maternal death than a white or Hispanic woman with a high school education. So it goes to show that education doesn't do a lot as far as these pregnancy-related deaths are concerned. One statistic that is often missed when we speak about maternal mortality is the fact that every woman who dies, there are approximately 70 other women who experience just a near miss. So we call severe maternal morbidity. This means that over 50,000 women each year suffer significantly during and after pregnancy. So in 2017, Louisiana had 65 pregnancy-associated deaths. And this includes deaths from pregnancy complication, and it also includes deaths from things like accidents, injuries, and suicide. Of these 65 pregnancy-associated deaths, 15 of them were pregnancy related, meaning that 15 of the mothers died as a result of complication that was created by or made worse by her pregnancy or the management of her pregnancy. Disparities remain evident. For pregnancy-associated deaths, nearly 2 Black women die for every 1 white woman, and for pregnancy-related deaths, more than 5 Black women died for every 1 white woman. And unfortunately, the deaths in Louisiana are continuing to rise. All right. So we talked about those numbers already. And so again, in Louisiana in 2017, there was the 65 pregnancy-associated deaths. So what we did was we decided to launch the Birth Story Project. And it started off as something really small. It was just a safe circle for mothers to get together, to share in, and to talk about their birthing journey and just the journey of motherhood as a whole. So during the statewide tour, the Birth Story Project event was hosted in Shreveport. And of course, we had great attendance, and there were a lot of stories shared by the mothers. But during the event, it was confirmed that there was a need for events like this, for safe spaces where mothers were able to talk. And then it also confirmed that we needed more data pertaining to the individual stories from moms. So the Birth Story Project survey was launched online, making it available for all moms statewide. And again, we will relaunch this in October, and we'll talk a little bit more about that when we have our panel discussion. So here are some preliminary results from our last Birth Story Project. So 88% of the survey respondents gave birth in a hospital. 41% were using Medicaid or were uninsured. And because of this training program, we were fully vested in the survey. And as a result, 14% of the respondents came from Regions 7 and 8, and 5% of them gave birth in Oshner Shreveport. So of that, 35% of the births were performed via C-section, and of that, 76% were primary cesarean sections, and 24% were repeat C-sections. So we know that C-sections are associated with increased morbidity and mortality, and research also tells us that doulas help to reduce the risk of cesarean sections. So 69% of the respondents did not have a doula. And of that 69%, 33% didn't know what a doula was or how to find one. And 27% could not afford one. And so here's some unfortunate quotes from some of the ladies who participated in the Birth Story Project. So I was never asked permission for any of the procedures that took place. I was taken advantage of as a young and inexperienced woman. I was referred to this doctor by family members, but there was never willing to answer questions nor had any birthing class information. And another quote, at 39 weeks, my doctor shocked me by saying I had to have my water broken because she was going out of town. I was completely devastated, but still trusting my doctor, I allowed it to happen. My body was nowhere near ready to have my baby, which resulted in an unwanted epidural, which turned into a C-section. So overall, while making decisions about my care for my pregnancy and birth, I felt pushed into accepting the options my healthcare provider suggested, even though I didn't want them. That says a lot. So these statistics and outcomes are what we want to change as healthy birth ambassadors. So we'll talk a little bit more during the panel about how you can get involved and what you can do. and what you can do to change things to help save lives, and how the church can actually work together, because we're all talking about families and how we can help these families and how we can move forward. So thank you guys so much. And that concludes my presentation.
Thank you, Alicia. That was extremely informative. And as Frankie has stated in the chat, y'all, if y'all have any questions, concerns, comments that you want reviewed at a later time, we will get to those. So please put that in the chat for us. Thanks again, Miss Alicia. Just want to lift you up. That was awesome. Now we have Miss Renee Antoine. She's going to discuss preconception health, health pregnancy, weathering, postpartum care transition to primary care, and lactation support. And so I'm super excited to hear this one. Thank you, Ms. Renee. Oh, unmute for us.
Thank you so much. Good evening, everyone. My name is Renee Antoine, and I serve as the Maternal Infant Health Director and Government Affairs Director for the state of Louisiana for March of Dimes. Our mission at March of Dimes is to lead the fight for the health of all moms and babies with our partner organizations like you all today on this call. Our overarching goals are to reduce prematurity when a baby is born less than 37 weeks gestation, to reduce maternal mortality and morbidity, which we've heard about previously, that unfortunate circumstance when a birthing person loses their life during or after labor and delivery. And also to increase equitable health care to all birthing persons throughout the state. As we previously heard, there are several disparate health outcomes throughout our state, specifically between the Black and white populations. And so we are working to change numbers regarding prematurity, infant mortality, as well as maternal mortality. How can we do this? How can we make sure that all moms, all birthing persons, all babies are as strong as possible from day one? Well, it takes multiple partners, multiple sectors, multiple systematic change initiatives, and to create the best impact, we have to have someone in every single sector. This includes education, research, community engagement and mobilization, direct programming and services for our families receiving services, connection to resources, and of course, leadership. You may ask yourself, what outcomes are actually impacting birth equity? Well, it's actually a multitude of things. There's actually not one simple thing, one simple solution or answer for this particular question. Birth outcomes are impacted by personal health. This includes nutrition, access to healthy foods, your overall health status, including stress, your social environment, your educational status, social stress, job opportunities, the overall healthcare system, your access to care, hospital and provider policies, even your insurance status, behavioral health, like your use of drugs and alcohol and tobacco usage. And last but definitely not least, your built environment, the neighborhood you live in, the safety. Is your community connected? Do you feel safe within it? The proximity to local resources. All of these things together are what we call social determinants or social drivers of health. Everything is integrated and it combines to give you your health outcomes. So it also is going to be the standing point and the blueprint for every single child that is born locally, nationally, and globally. So let's get into some factors that could impact a pregnancy journey. Stress, life demands or challenges that exceed one's ability to cope, thereby increasing health risk. You may not actually think that stress is a really important topic, but in fact it is. And we're going to get into a little bit of this later with some of our other presenters, but I want to let you know that stress impacts pregnancy. So as stress in your daily life and your social environment goes up, your physical health goes down. All of your systems in your body work together for your greater good. Your hormonal system, your immune system, your epigenome, also with epigenetics, your cardiovascular system, even your respiratory system. Everything is intertwined to give you the best possible outcomes. So stress impacts these outcomes greatly. How does it take a toll on the body? So you may remember in your science class in high school where you learned about homeostasis and fight or flight. So a certain amount of stress is actually expected in our daily lives every single day, every single week, where we live, where we work, where we play. There's a certain amount of positive stress and also negative stress that we tend to interact with. The issue is when we are in a constant state of chronic stress. That can really weigh on our maternal mental health. When we're in this constant state of chronic stress, our body is not able to fully recover. When we're not able to fully recover, that wears down our physical health and those internal systems that I previously mentioned. It is known and reported through many studies that African-American pregnant women report more stressors and greater emotional distress than pregnant women from all other racial and ethnic groups. This means that the allostatic load for African-American pregnant women is going to be increased, which also means that we would be in a constant state of chronic stress longer than other populations in our same environment. This is called weathering, the constant disintegration of our allostatic load and the ability to actually cope and manage and balance our stressful interactions on a daily, weekly, or yearly basis. Why is this the case? Well, you might think to yourself, what types of jobs, titles, responsibilities might a birthing person, especially one of color, have on a daily basis? Well, they're dealing with job balancing, where they live, their neighborhoods, housing, social policies. Sometimes they're even dealing with what we called gendered racism, where because someone maybe a birthing person who's a female as well as a person of color, they have a combination of different isms that are working against them in life. Family support, poor working conditions, etc. So all of these things together can actually weigh on our mental health, thereby increasing our allostatic load and creating that weathering effect. So today, with other presenters as well, we're going to make sure that you have a really good self-care agenda to make sure that your allostatic load and your chronic stress levels are reduced as much as possible through your pregnancy journey. Why is this important for your child? Well, another fact that you may not realize is that health actually is across generations. That means from the day that you were born, your genetics were pretty much set. So you were already carrying all the things needed to create your children, and that's going to follow you throughout life. So we have studies that show a birthing person's birth weight and the age in which the gestational age that they actually gave birth is going to determine or be strongly correlated with their infant's birth weight, gestational age, and their fetal growth. Also, fetal growth restriction. This means that health history really does matter. It also means that your preconception health, which we're going to get into very soon, the health before you become pregnant, matters the most because health is a full lifetime and lifespan approach. It's not 1 month, it's not 1 year, it's not 6 months. Everything you do from the day you were born up until you conceive a child matters for your birth outcome. So let's walk through the pregnancy journey. That preconception time, before you're actually conceiving a child, you should really be showing your love to your body. You should have what you call a preconception checkup. This is also known as an annual exam with your primary care provider. You should discuss your childbearing intentions or plans if you have any, and also take an assessment of your family history to manage underlying health conditions that maybe have not been a problem in the past, but could be a potential problem in the future. And I'm going to talk about managing some of these in great detail in our prenatal portion, but your preconception body really should be gearing up for your pregnancy body. Your health before pregnancy matters greatly. 100%, it's all connected. And so if you're thinking of becoming pregnant, or if there's any chance that you may become pregnant, even in the next year or two, you should really start acting as if you're pregnant right now. After you get that preconception checkup and you successfully are able to conceive, you'll then start your prenatal appointments. During these times, your physician, your OBGYN, should be asking you about your family health history. If they are not, please give that information to them voluntarily. If you know you have underlying health conditions that run in your family, such as maybe high blood pressure, it can really impact the health of your pregnancy and the health of your baby. You may ask yourself, how is high blood pressure connected to a pregnancy? Well, high blood pressure is the force of blood that pushes against the walls of your arteries. And so high blood pressure, also known as hypertension, is when the force of blood against the walls is too high, right? It can stress your heart and cause problems during pregnancy. If not treated, it can cause problems during pregnancy like premature birth and preeclampsia, which is a well-known condition when a birthing person has blood pressure that's way too high. So really making sure if you have blood pressure that's going to be over 120/80, which is considered a normal blood pressure reading, you're getting that checked. I oftentimes tell our partners and families to keep a blood pressure cuff at home. Your insurance provider, whether you have private or public insurance, will be able to provide you one. They're also a very low cost at any of your drugstores or local convenience stores. You should be checking your blood pressure readings on a weekly basis during your prenatal journey, so that when you go to the physician's office, if you are presenting with a reading that's abnormal or not in line with what you typically have had during that pregnancy journey, or even preconception wise, you're able to alert your physician and they can make sure they are connecting you to the appropriate resources. Some women have to take a low dose aspirin during pregnancy. Others have to get on a certain diet to make sure their blood pressure is kept at a certain balance. Please note that hypertension during pregnancy can cause organ damage and failure and result in several disparate health outcomes for your newborn. So it's vitally important to get that checked and make sure you're checking it every single week and keeping a pregnancy journal. You also want to make sure you're exercising and getting your heart health in check. Nutrition wise, making sure that you're eating fresh fruits and vegetables and taking your multivitamin, making sure you have a prenatal vitamin that has the correct amount of folic acid in it. It's really important to make sure the spinal cords in your babies are developing the correct way as well. Also, because we are living in a pandemic with COVID-19, making sure all of your vaccines are up to date. Yes, we recommend all vaccines be up to date for pregnant women. And you really want to make sure your vaccines are up to date before you get pregnant. And you may ask, well, if I'm pregnant, can I currently take the COVID-19 vaccine? Yes, you can, and we recommend it for all birthing persons. There is no evidence or research that would suggest any negative effect on your placenta health or your newborn health. So it's vitally important that we're protecting ourselves against the COVID-19 virus, because we know that those pregnant women who have unfortunately contracted COVID-19 have shown sometimes very, very negative outcomes during the birthing process or during their pregnancy journey as well. So please make sure you're receiving consistent and accurate information regarding COVID-19 vaccines, and know that we support all vaccinated birthing persons, because it could be life or death for you and your baby. And the typical lifestyle changes of abstaining from any drugs and alcohol or recreational drug usage is also vitally important. Transitioning from that prenatal period to that postpartum period is going to be an entire new world. That primary care transition is really important. That means after that prenatal care journey is over, you need to make sure you are connected to your primary care provider. What does this look like? Well, during your postpartum checkup with your OBGYN, if you're unsure who your primary care provider is, they can help you navigate that system. It's vitally important that you keep up with all of your underlying health conditions and any medicines that you have to take while you were pregnant that you need to continue taking during your postpartum journey. making sure you're also getting screened for mental health disorders, which are very, very prevalent in the postpartum period. It's the most complicated and the most common pregnancy outcome, having some type of perinatal mood disorder. So getting that checked as well, and having your support system in place. It's a very hard time for birthing persons. Making sure that your body is fully equipped and nurtured after that pregnancy is going to be super important. So taking those walks, getting the breaks that you need, having folks in place to care for other children, having your support system from your congregation, because it's the faith-based seminar. So there are so many things that the faith-based population can do to support birthing persons during this pregnancy journey, as well as this postpartum journey. And it's different for everyone. It looks different for every single person. But the good thing is that the community that we live in, we've gone through it quite a few times, and we have some best practices that tend to work well across the board. So really making sure you are really leaning in to that postpartum period, and any type of underlying health conditions such as high blood pressure or diabetes are still being maintained throughout the process, because we know that up until a year or even sometimes afterwards, birthing persons can still have negative health outcomes from pregnancy. So in conclusion, please know that everything is connected. Your preconception health, your prenatal health, your postpartum health, it's all connected to your physical and mental health. And speaking of your physical and mental health, during that postpartum and interconception journey, breastfeeding support is also very important. There are tons of great breastfeeding resources on our website, as well as some others that I'll be putting in the chat today, to really make sure that you are utilizing the best nutrition for your newborn, which is breast milk. So if you're able to breastfeed, and if you're choosing to, whether you're pumping or directly nursing, it is going to be the best way to feed your child if you're able to. And also getting support with that. It's also very difficult sometimes because of stress levels and milk supply to do it on your own. So reaching out to your primary care provider or any other breastfeeding resources in your area is going to be vitally important, especially because we are now discovering that there are antibodies found in breast milk that can not only be healthy for your newborn, but other children in your household as well. And with this COVID-19 pandemic, we know that our newborns are not able to get vaccinated, but the antibodies coming from the mother's milk and passing through that placenta will be found in their system as well. So it's great protection for them as well. Also, our overall arching education around supportive pregnancy is making sure that you have your prenatal education, your postpartum education, your clinical care from your healthcare system, self-empowerment, but also mutual support from your community. So that's going to be, as I mentioned before, your faith congregation, families, friends, those who you work with, making sure that we are approaching pregnancy from a community standpoint is vitally important to reduce some of these negative perinatal outcomes that we're seeing, especially in our Black and Brown women in the state of Louisiana. Again, individual level, health system level, and wider community. That's going to be the approach that we need in order to drive down those negative rates of pregnancy, and to equip more birthing persons to be able to successfully navigate our healthcare system and our community wide resources that we have as well. Equity, access, and prevention. As long as you remember these three things, you will for sure be more likely to have a healthier outcome. We believe that every baby deserves the best possible start. Unfortunately, not all babies get one. So we are changing that from advocacy to education to research. We're working to level the playing field so that all moms and babies are healthy. Because when a society supports every family, the future is brighter for us all. And when communities work together, even the toughest problems can be solved. Thank you.
Thank you so much, Renee. That was amazing. As folks are typing in the chat currently, y'all, if you've got any questions, we know there's a lot of information and a little bit of time, but I'm hoping y'all are absorbing it like I am. This is some good stuff, but please put your questions in the chat. Thank you. Now we're going to hear from a male perspective. So I'm super excited. Dr. Bantu Gross is going to talk us through the next portion of our webinar. He's going to discuss the importance of fathers and partners during pregnancy, fathers and partners' role in improving birth outcomes, and last but not least, paternal mental health, which is something we don't hear a lot about. So super excited. Take it away, Dr. Bantu.
All right, thank you, Ms. Joshua. Thank you all for having me. My name is Dr. Bantu Gross. I'm the husband of Dr. Tara Gross and the father of 3 children, Amari, Nia, and Kylel. And Amari is in the house today because he's in quarantine because his school, someone contracted it, so he's running around somewhere. So if you hear any noise in the background, it's probably him. But I'll do my best Carrie Monk's impersonation of being a panelist and a parent as she was blowing her daughter's nose earlier, which I thought was very funny and cute all at once. But what I'm here to talk about is the importance of fathers and partners during pregnancy. And so for me, as I think about the birthing process, the birthing story, and my side, my perspective of it is that we should be more like advocates. We should be advocates for moms as they're going through pregnancy. I remember one of my favorite quotes I heard was, mothers are protecting the baby and fathers should be protecting the mothers as they're trying to allow this baby come into the world. And so one of the things I think about again is advocacy, and that we should be there by their side, by women's side, as they're going through this whole process from preconception to prenatal to postpartum. I know for myself personally, I attended the majority of those prenatal appointments, so that way I can talk to the doctors, interact with the midwives, and find out what's going on. What are some things I should be knowing, and why are we trying to run these different tests? What are these tests about? And so I think for me, just becoming more knowledgeable, because obviously women are carrying the baby, so they have a little bit more information and they do a little bit more digging. And so I didn't want to be a guy that was just like, well, that's her baby. Well, no, it's my baby too, and I need to be involved in this process. So what are some things she needs to do? That she needs to exercise more, that she needs to drink more water. And so how can I be a part of that process? And then just like Renee and even Alicia talked about earlier, all the stress that women are going through, that this woman is pregnant and below the surface, she's dealing with all this junk. And so why would I want to add to that stress? Why not be someone that can help lift some of that stress off of her shoulders? And so one of the things we like to talk about with the guys we talk to on Thursday nights in our dad discussions is that we need to provide emotional, physical, and financial support, and at times spiritual support, especially since we're talking about this Black church joy here. That's a very important piece. And we know that within the Black community, just how important church and spirituality is. And so how are we helping with that? How are we playing a part that's benefiting moms as they go through this process? Another thing I think about is the birth outcomes. Again, Renee and Alicia pointed out the low birth rate. They talked about preterm birth and things like that. And I know that when fathers are present and they're providing support and care and comfort, that those things tend to go down. There's tons of research out there that shows that when fathers are around and fathers are involved, that mothers are a little bit more at ease and that they're able to carry this baby to full term, and that they're able to have babies that are healthy and babies that go past the age of 1 and beyond. And then on top of that, we know that when fathers are talking to the baby while it's still in the womb, that child's vocabulary is going to pick up. We know that fathers are more likely to play with kids, roughhousing, and instilling them confidence, let them take risks, be a little bit more creative. And they do all this to complement mom. I think I want to stress that the most, that we are complementing one another, that one parent isn't superior than the other. That's one thing we try not to do in our household. One thing we try not to teach other men, that there is no hierarchy in parenting, that we are both on the same level playing field, and that we should act accordingly because we're adults. And so those are some of the things that we like to talk about when we have men in the room. And another thing too is the maternal mental health side of it. A lot of times when mom is going through this process, uh, fathers are sort of forgotten about. They're just there. And so a lot of the attention, a lot of the support goes to mom when the baby showers are being prepared and thought about. That it's for moms. Dads aren't really included, or if they want a dad involved, might say, well, give him a grill, or give him a TV, or stick him in the back room, give him some barbecue chicken, he'll be fine. But instead, actually engage those dads in those moments, and that way he can feel a part of it. Because a lot of times, men, we don't really like to talk that much. So this is an opportunity to have us engaged in that conversation about what's going on with this child. What term are you in? You know, what trimester are you in? First, second, third. What does that mean? If you're having a baby at the 29th week versus the 30 plus week, what kind of developmental milestones will my child go through? What type of emotions is my wife going through? Is this normal? Is this natural? So paying attention to things like that. And even once you're actually in the birthing room, the role you should play. I know for myself, I was in a birthing room with my wife for all three of our children, and all three of those experiences were different. And I do remember the first one being somewhat traumatic in the sense that the doctors did not want to pay attention to my wife's cries for help when she was in pain, when she was saying, I need a little bit more pain medicine. And they're asking her, are you sure you need it? And she's like, I'm absolutely sure. Well, are you absolutely sure or sort of sure? And so going through this whole back and forth, and me being able to say, I think she's pretty sure that she's in pain, and let's take care of this. And so thinking about her being in this position where, you know, she's so vulnerable, and had I not been there, had she had no one at her side, and for someone to just take advantage of her, and we see that happen so many times. And then again, she's already walking in that room uh, with all this stress, like Renee was talking about, the weathering effect. And then you're actually in the room giving birth to a child, and they're compounding it with additional stress. They're coming at you with questions like, are you ready for your epidural? Should we do a C-section? Should we do this? And she's just trying to push a baby out. And so that's where we need to be at. We need to be by their sides. And I know doulas are great at their jobs. I love them. I support them wholeheartedly. But I know that there are some things that they just can't do legally, that they can say whatever they want, but legally, the doctors don't have to listen to them. But legally, they have to listen to the fathers. And I think that's where we can come in. And I think, again, going back to advocacy and educating ourselves and partnering with doulas, because there's so many great things that doulas do that we can learn from as fathers. So that way, when we're actually in the room, we can do some things. And especially now in these COVID times, you can only have one person in a birthing room now. And so moms are trying to decide between father or doula in some cases. And so I would behoove men, I would behoove fathers to get that education, because a lot of times I think moms will go with the father, obviously, if it's a healthy relationship. And so having that information, to be equipped with that, to pay attention to what the doctors are saying, you know, what in reading the machines, what's the baby's heart rate? What's mom's heart rate? What is this monitor telling me? What is that medicine for? So constantly asking questions, because that's all right when we're in that room. We can ask questions. We can't just allow them to poke and prod us as if we're experiments. But to take this serious, that, you know, we're waiting for this child to enter this world. We're waiting to enter into fatherhood, that we've gone from boyhood to manhood, and now we're entering fatherhood. And that this journey, that this new stage of our life is going to be defined by how we protect, how we provide, and these different characteristics. And this is one of our first opportunities to actually father our child. And so that's what I wanted to share. And I thank you again for having me to be a part of this wonderful discussion.
Thank you, Dr. Bantu. And I'm seeing one of the questions already. I just have to throw this out there because I know folks are excited. Alexis Rossum put in the chat, how can dads join in on the dad discussion that you discussed or you mentioned earlier in your conversation?
Yeah, I have a link I can share with Frankie, and she can share it out with everybody once we get off.
Perfect. Awesome. Well, we'll be looking forward to that link, and thank you for that information. Frankie, did you want to get us started into the question and answer section?
Yes, thank you. Thank you, Caitlin. And thank you, Dr. Gross. So I am actually going to take a second to introduce Ayana Usuri. She is an Amandla Scholar. She is a recent graduate of with a Master's of Public Health from Xavier University, and she's been really doing some really amazing things behind the scenes that have deeply contributed to the success of the Amandla Group. So I want to give her props and give her a shout out and just thank you for everything that you have done to just help us get all of this great stuff out in the public. So thank you. So Ayana, I see we do have a few more questions populating in the chat. So I'm going to turn it over to you to lift those up. Got a question from Christina.
Yes, I do see it here, and I'll just go ahead and say thank you, Frankie, for that. It's wonderful to be here on all these webinars. Always great information. And definitely I encourage our participants who are on to, definitely ask your question. There's no stupid questions. There's no dumb question. We want to answer what you're thinking. So definitely feel free to share them with us in the chat or the question and answer. But yes, from Christina in the chat, she's wondering, how do I send my husband to these dad discussions?
Yeah, again, I'll put my, actually I could put some information in the chat, and also I'll send the link to Frankie. She can send it out to everybody.
Fantastic. And Ayana, I will just allow you to go ahead through the chat and see if there are any more questions. Well, let's see how we're doing on time as well, because we do have some time for a few more questions. And I want to actually throw a question out to Renee. Renee, you were talking earlier about high blood pressure, and I'm so grateful for all of your advocacy work and all of your just public education work that you've engaged in. A few months ago, you and I started working on this series together called Under Pressure, which we have shared from the Amandla Group's Instagram page. And we're going to continue this conversation because we talked about just how much, at least in our Black community, we hear pressure so much. I can speak for myself and say that as someone who had pregnancy-induced hypertension, who still is dealing with hypertension now post-pregnancy, hopefully it's temporary. My mom has dealt with high blood pressure. My grandmother, I have, cousins, aunts, and uncles. Like, I grew up hearing pressure. My pressure is up. But I'm like, it became so normal that when my doctor said I had blood pressure issues and high blood pressure, I really had to go back and figure out what that meant, because I honestly didn't know, and I work in public health. So I had to see exactly what that meant, because I knew about preeclampsia. I knew what that was, but physically I didn't know what that process was and what it was doing to my body. And I'm so happy that you broke that down. I'm curious to know from you, what can we do to normalize these conversations on high blood pressure? So when people hear, okay, your blood pressure is high, when you're in the office with your doctor, that doesn't go in one ear and go out the next, and you go on about your business, and that could be potentially deadly for mom and for baby.
Yes, thank you for lifting that conversation topic and question up, Frankie. It is vitally important, especially for the Black community, to understand that high blood pressure should not be normalized. We oftentimes take visits to our medical providers, whether you're pregnant or not, and they may tell you, oh, you have a history of high blood pressure, or your particular demographic has a history of high blood pressure. Well, just because something is historic does not mean it should take place in the future. Healthy is healthy, unhealthy is unhealthy, right? So having high blood pressure, even if it is trying to be normalized in society, is not a good fit for the Black community. We know that, especially while pregnant, it can be life or death. And unfortunately, I'm sure we all know someone where it was a life or death scenario for themselves or for their child. So I said this in my presentation. It's really important that we also know the signs of preeclampsia. So really quickly, I can go over some physical signs of preeclampsia for those who may be pregnant on this call or know someone who is pregnant. A constant headache that doesn't go away. Oftentimes, birthing persons may report headaches during pregnancy, but a constant migraine that's not going away and that's affecting your vision could be a sign of preeclampsia. Also, any type of swelling in your legs, your hand, or your face that's really abrupt. Like you were fine one day, you were normal size, and all of a sudden you're gaining 5 pounds a week. That's actually not typical during pregnancy. Weight gain should be slow and progressive. So if you're gaining a lot of weight all at once, week to week, that could also be an underlying health condition associated with high blood pressure leading to preeclampsia. I also want to let you know, seeing any types of spots, having a hard time breathing. Now, if you're, in your third trimester, you might consider that normal, but actually not all the time, right? So what I'm trying to say is we've started to normalize negative side effects associated with underlying health conditions as our everyday life, but really and truly, those are actually contributing to these negative outcomes, and we no longer want to do that. And so marchadimes.org and several other partner organizations actually have a list, like an infographic that tells you all the places in your body where preeclampsia can present itself and how to detect that. Be mindful that it does not present the same way in every person. Every body is different. Literally, every physical body is different, right? And so if your blood pressure is showing to be high when you are doing your assessment for yourself, which you should be doing on a weekly basis if you're pregnant, right? Even if you don't have some of these other signs and symptoms, you still need to ask your healthcare provider about it. I know so many of my friends who were fine throughout the first portion of their pregnancy, and all of a sudden one day they went in for a prenatal care checkup. They had to be delivered that day. They had to decide their life or their baby's life, unfortunately, right? And so we want to have those types of situations reduced. So we know that knowledge is power. So not really just shoving off, as Frankie mentioned, if someone's like, hey, you're like 140 over 100 today, you need to get that checked, right? Don't disregard symptoms and any type of differences in your physical health from week to week or even month to month. Please keep track of it. Have a journal. Whether you're pregnant or not, you should really be keeping a health journal, in my opinion, of your typical readings for your glucose level, cardiovascular health, as well as blood pressure. It's really, really vital for, I think, communities of color, because we have disparate health outcomes across the board, even before we become pregnant. And that's why they're causing so many issues prenatally. And really, by that time, it's too late, to be honest with you. By the time you become pregnant, it's already set, it's already there. And so that interconceptional period after pregnancy, it's also important to manage those conditions. Keep taking whatever medicine your doctor has prescribed, and getting back into that primary care provider's office as well. So I hope that answers the question, Frankie.
And if it's okay, can I jump in right in there?
Yeah, absolutely.
Renee said a lot of great things, but this too is also where your Healthy Birth Ambassador can really come into play. Exactly. Because within the Healthy Birth Ambassador training, we do go through what are the norms, what are abnormals. Dr. Bantu actually did a session with us discussing dads and how they can be active. But we also talk about those signs and symptoms of where you need to notify your doctor. And so during pregnancy, if you're seeing a midwife or OB, what typically happens is that you have so many visits up until, you get to about that 35 week. Well, with your Healthy Birth Ambassador, who's also a certified doula, certified breastfeeding specialist, a childbirth educator, and a perinatal community worker, we are there on a more consistent basis, and it's also more informal. We work within our community, so oftentimes they feel a little bit more comfortable saying, hey, I think this is going on, or this might be going on, or I'm feeling this way, like, what do you think, or can you help me? And so what we're able to do is pull back, and I'm a nurse as well. So we talk about a lot of these things, but we're able to pull back into, our knowledge and research. And we always, of course, if there's anything significant, refer, to the doctor, but then we also teach how to advocate, because what we hear, and I've heard quite a few times, it's really alarming. The doctors will send them back home, or the nurses will say, hey, just go take a Tylenol and lay down. And now we're looking at a whole new set of problems. So I just wanted to, throw that in there. That is, I mean, that's the privilege and even the life-saving part of actually having a healthy birth ambassador, someone who is from your own community, who has been educated, who will also educate you, who will also educate the dad on things such as hypertension. What are some steps that we can do? What do we need to do? How can we at least try to get this under control a little bit? And not only that, but how can we help you to discuss this with your doctor? Because sometimes we get lost in that place of, I'm the patient and then this is the doctor. Whatever they say is good, this is what goes. But then a lot on our advocating side, we're teaching, hey, what you have to say is important. You're the whole reason that the doctor is here. So just teaching those things and having that person, again, from your community that's able to really understand you, but then who's also able to help you, and I hate to say it this way, but to help you be able to speak with your doctor to try to get them to understand you, because a lot of the times that's where the problem is happening. It's the way that they're communicating or attempting to communicate, with us. So just wanted to put that out there. Thanks.
Thank you, Alicia. We feel your passion, and we just love the work that's being done with the Healthy Ambassadors program. We know that there's been a cohort that's already completed, and they are out on the front lines in the community helping birthing people have successful pregnancies and healthy babies. So thank you for that, and definitely feel free to chime in and share. If anyone wants to take an opportunity to answer any of the questions, if they haven't been posed directly to you, please chime in, because you do realize the breadth of experience and knowledge in this Zoom room. So please jump in. So thank you so much for taking time in this segment to lift up questions from our audience. We definitely want to hear from pastors, leaders, congregations, and those in the general community who have taken time out. So we will have an opportunity for questions and answers at the end. So definitely write them down. We will get to them because we want to hear from you. So thank you, Ayana, for lifting those questions up. Thank you, everyone who shared. I'm going to go ahead and turn it back over to Caitlin to introduce our next speaker.
Awesome. Thanks, y'all, for weighing in. And so our next speaker is Dr. Megan Bourne-Gilbert. She will discuss maternal mental health. Dr. Bourne, we're ready whenever you are.
Hey, y'all, can y'all see and hear me?
Yep, we can see and hear you.
All righty. And then where can I view the PowerPoint? I don't know if my view is.
Sure. Ayana has not placed it up just yet, so you should see it populate in a few seconds. She's going to share her screen.
Okay.
Yes.
All right. No problem. But while she's doing that, I'll introduce myself to you guys. I am Dr. Megan Bourne-Gilbert. And I'm here representing the Maxine firm and Born to Make a Difference LLC. And I am very thankful for Frankie for inviting me to talk to you all today. All right, we can go to the next slide. All right, so when we think about mental health disorders, there are a couple of mental health disorders that are more common among postpartum women than others. And so, what we do know is that approximately 85% of women will experience some type of mood disturbance during or after pregnancy. 10 to 15% of those women do develop more significant symptoms. And then, when we think about mental illness among women, it kind of goes across like a continuum. And so, the first thing that we typically see, which is typically about 85% of the women, we see the postpartum blues. Another thing that we also see is called postpartum depression, and the most severe of the three of the mental health disorders is postpartum psychosis. And I'll talk to you about a little bit about each one of those in the next slides. So when it comes to postpartum blues or baby blues, you guys may have heard of this, but this appears to happen in approximately 50 to 85% of the women who give birth to babies. So it's not something that's really uncommon. If you think about 85%, that's pretty much a large percentage, if not most, of women who do give birth will have some type of mood disturbance. Common symptoms of the baby blues or postpartum blues will include like changes in moods, tearfulness, irritability, or anxiety. Now, with these symptoms, they tend to last for a few hours and can go up to 2 weeks. But what we do know is that if these symptoms continue to persist past the 2 week period, then it may be time to evaluate for something more severe, which is when we discuss the postpartum depression. Next slide, please. All right. So postpartum depression will typically occur anywhere between the first 2 to 3 months after postpartum, but may occur at any point during delivery. Now, when we think about the symptoms of postpartum depression, they're really not that different from depression that a woman would experience at any other point in her life. And so some of those symptoms are going to include like tearfulness, depressed mood, changes in interest and activities. So, for example, if the mom previously enjoyed things such as cooking or dancing, those activities just don't bring the same amount of pleasure anymore. You may also notice some fatigue, changes in sleep, which can be hard to distinguish between whether or not the mom is just tired from being up at night with the baby or if there's something else going on. Changes in appetite and concentration are also present. Sometimes thoughts of self harm or thoughts of harming the baby can be present. And then a lot of times, moms who are experiencing postpartum depression tend to experience difficulty bonding with the baby and tend to have some of those feelings of guilt that they may not be a good mother or they're not doing enough to provide for the baby. Um, these symptoms tend to last longer than the baby blues. So when we talked about the baby blues, that tends to last approximately 2 weeks. But with postpartum depression, this can last from anywhere from 2 weeks to a year postpartum. So it can last for a while if untreated. Next slide, please. And the most severe of the three is postpartum psychosis. And this is very rare. However, it does occur in approximately 1 to 2 per 1,000 women after childbirth. And so, a lot of times, the symptoms of postpartum psychosis can really look like or mimic a bipolar illness. And so, when we think about bipolar disorder, we're really thinking about like symptoms of mania, and then sometimes individuals will experience symptoms of auditory hallucinations as well as delusional beliefs. So, some of the things that you may be able to look for to identify whether or not a mom is experiencing postpartum psychosis are early signs like restlessness, irritability, insomnia, but you also notice rapid changes in mood. Sometimes a mother can look or appear to be confused or depressed and can demonstrate some really disorganized behavior. The mom may think that she's hearing voices or she may be seeing things that other people don't see. And so we're really looking at what we call a psychotic episode in those moments. Now, as far as treatment is concerned from this, do know that there is nothing that can be done at home. If you ever notice that a mother is exhibiting any of these signs or symptoms, the best form of treatment is going to be inpatient treatment, right? So that means this person needs to get to the hospital ASAP. Next slide, please. All right. So who's at risk for this? Like who can be diagnosed with baby blues? Who can get postpartum depression? Who can be subjected to the postpartum psychosis? When we think about these things, I want you to think about this. For sure, anybody who's had a previous episode of postpartum depression can be at risk for having postpartum depression again. So it's not something that just occurs with the birth of the first baby. This can occur for a second birth, third birth. Um, if the individual had depression during pregnancy, or if they've had depression at any other time in their life, they're at greater risk for postpartum depression. Also, if they have a history of any other psychiatric illnesses, such as bipolar disorder or schizophrenia, they can be at risk for postpartum depression as well as postpartum psychosis. Other things that may come into play when we think about postpartum depression can be recent stressful life events. So, any pregnancy complications, loss of job during pregnancy or after pregnancy, or any other health concerns at the time can play a role in an individual's risk for postpartum depression. Other things such as inadequate support. And so, if it's a single mom who may not have the help that she requires, or doesn't have a strong social support network with friends or family who can help out, it is more likely that this individual may experience postpartum depression. Other things include marital problems, financial issues, having a baby who has special needs, having multiples, so a mother who has twins, triplets, and if a pregnancy was unplanned or unwanted, are all risk for postpartum depression. Next slide, please. Ways to help mom. And so how do we kind of try to prevent this? We do know that postpartum depression can't identify the actual cause of it, can't pinpoint the cause, but we do know that there are several factors that play a role. And so one thing that we have to take into consideration is hormonal changes, changes in routine, schedule, and all of those things play a role. And so ways that we can help mom include, if this is a family member, a close family member, a close friend, making sure that you help out with like bathing the baby, changing diapers, doing things for mom that include like feeding the baby so that she doesn't feel like she's alone and doing all the tasks on her own. Helping to soothe the baby when the baby is crying. I know a lot of people who's not a parent, the baby's parent, have a tendency to hand the baby back over to mom whenever the baby is crying. But if you can help out by soothing the baby or figuring out how to get the baby to stop from crying, this can be beneficial. For dads, one thing that can be beneficial is taking the baby out for a walk so the mom can get some quiet time. Because a lot of times, what we do notice is that if dad goes back to work and mom's in the house all alone, then all of her time is consumed with the baby and she doesn't have a chance to get that alone or me time. And so, if she can get special time to be able to do that, that would be important. And then just knowing if there are other children in the house, finding creative ways to help look at after them so mom can have her own quality time would be beneficial as well. Right? Next slide, please. Um, just knowing like when to seek help. And so it's important to be able to seek help if symptoms don't fade after 2 weeks. A lot of times with the baby blues, there's no treatment that's necessary for that because those symptoms will spontaneously go away on their own. However, if those symptoms stay present for longer than a 2 week period, or you notice changes in the mother's behavior, whereas she's not her normal self, she's having difficulty engaging in regular life routines like getting out of the bed, engaging in self care, such as simple things like day to day activities, brushing teeth, combing hair, or anything like that, that might be a sign that it's time to seek help. If you notice that any of those symptoms are progressively getting worse, that's an important time to seek help. Things that make it hard or difficult to care for the baby. And then any thoughts or reports of harming the baby or wanting to harm herself. If you notice any of those things in the mom, then it's really important to help them identify a provider, a medical provider who can help them with the symptoms they're experiencing. Any questions?
Yeah, if there's questions, feel free to type them in the chat. Dr. Bornay, your presentation as always is just powerful. It's always great to have you with us and just share your knowledge. We were definitely blessed to have your presence a few weeks back in New Orleans when we had our one in-person event, Black Mama Joy, and so excited to have you with us and certainly look forward to working with you in the future to continue this conversation and the Maxine firm as a whole. So
Thank you.
definitely. So now we are actually going to move into our next segment. If there are questions, because I don't see any questions in the chat right now. Well, we can go ahead and We're going to save the question from Janae about doulas because we're actually going to go back to a question later, but I don't see any mental health questions related to your presentation. So thank you so much, and just continue to stick with us. We're actually going to transition to our next part of this conversation, which is our panel discussion. So the question was, what can faith leaders and congregations do to impact Black maternal and infant health? So that's what we're going to talk about right now. So we're going to kind of do take approaches from like a rapid fire type approach, where we're going to have Ellen, Alicia, Dr. Bantu Gross, Carrie Monks, and Dr. Megan Bourne-Kilbert just take 4 to 5 minutes each and share how can faith-based organizations impact maternal health? So from your viewpoint. So first, we're going to start with Ellen McKnight, who we haven't heard from yet. And for those of you who may not be familiar with Ellen, which I don't think there's anybody on this planet who's not familiar with the great work that Ellen does with the Maxine firm. She's a proprietor, and she's so modest, y'all, with the Maxine firm. And she is doing so much great work in the community. So Ellen, I will turn it over to you to say a little bit about yourself and just answer the question, how can faith-based organizations impact maternal health?
Thank you so much, Frankie, and hello to everyone. My name is Ellen McKnight. I'm the principal of the Maxine Farm. And so what the Maxine Farm is, it's a nutrition, wellness, and public health firm. And our primary objective is chronic disease prevention in rural and urban communities across the state of Louisiana and the rural South. I have the great pleasure of working with a network of primary healthcare professionals, primarily women of color. So Dr. Megan Bourne-Kilbert is one of the partners in crime, and we do this work. And so the question was, how can our churches, what can our churches do to help in this space? And so there is a faith-based wellness arm that our organization has the opportunity to do. And so like I mentioned before, we travel across the state of Louisiana, pretty much equipping congregations with tools and information and health literacy around about 5 pillars. So one is nutrition and wellness. The next is mental health, and Dr. Bourne-Kilbert leads that effort. The other one is urban agriculture, so growing real food. The other is mindfulness and meditation, physical activity, and the last one is chronic disease education and prevention. And so when we talk about what can churches do, we can essentially, what churches can do, we can do a lot of culture shifting, changing the conversations, making certain that doing things that are embedded in our services. So for example, I like to give the example a lot. We have a lot of funerals, in our churches, any church, right? But, you could be at a funeral for somebody who died from a heart attack, but when you go to the repast, all the food at the repast are things that you eat that make you die from a heart attack, right? So we do a lot of fellowshipping in our church functions. We have a lot of meals. It's surrounded, it's ingrained in our culture. So just making some small shifts in the within our food ministries at our churches, because they're ingrained in every aspect. So if it's a choir anniversary, pastor anniversary, the funeral, whatever it is. So there are some churches that have actually shifted away from fried chicken. It was a big thing they did on CNN, but the pastor has completely shifted away from fried chicken. And so there's and his name is Dr. Michael Miner. He's a church in Mississippi. He has a partnership with the National Institute of Health. He has banned it from his church. So essentially, they make sure that they have grilled options, not just chicken, but grilled fish, grilled chicken. Whenever they do large feeding events that have staples like red beans and rice, they have shifted to brown rice, wild rice. They have also kids. We have Vacation Bible School, and so they are no longer providing Cokes and things like that, and candy and things like that for Vacation Bible School, for Sunday school, and then after children's church. So if they do get chips, those chips are baked. So they just went down to Sam's line and got the baked options instead of the regular option. They have switched to like nut mixes instead of potatoes, instead of like candy and things like that, dried fruit, and then fresh fruit. A lot of our churches serve breakfast, and a lot of those breakfasts most of the time is like donuts or something sugary, they make certain that they have a healthier option like oatmeal and yogurt if the church is serving breakfast. And then also every month, healthcare ministries a lot of churches are instituting healthcare ministries. So if you have a healthcare ministry in your church, there's an opportunity for you to do some asset mapping within your congregation. Like, what healthcare professionals do we have in our congregation? Let's go ahead and get ourselves, a ministry set up that is focused on education and advocacy and highlighting those months. And so, there's a cardiovascular month, breast cancer month, prostate cancer month. And we know that every month, every illness disproportionately affects African Americans and the like. So with Black maternal health, that's the opportunity through the healthcare ministry, through those persons who are in the healthcare field within your church, to offer literature, education, events within the congregation. Now, say for example, your congregation does not have folks who are in the healthcare field, you do not have a healthcare ministry already established. As I already mentioned, the Maxine Firm has a strong, faith-based wellness arm. And we go to the places. We will go near and far, rural, urban, because it's really important that Black folks, people of color, urban and rural communities are equipped with this knowledge to command their own health. So thank you so much, Frankie.
Thank you. Thank you, Ellen. All right, a lot of great information. Type those questions in the chat. And I see that Rebecca Brown has her hand up. Rebecca, you can lower your hand and get to typing in that chat, and we will ask that question if that's a question when we get to our Q&A. But thank you for engaging. So now, Alicia, we're going to toss it back over to you. We want to know, how can faith-based organizations impact maternal health? Take us to church.
All right. So through the Healthy Birth Initiative for Louisiana, that's actually what we're working on now. So what you can do, real simple, sponsor a Healthy Birth ambassador. Sponsor a Healthy Birth ambassador for your particular church. So like I said, I attend Praise Temple Full Gospel Baptist Church here in Shreveport. I'm their Healthy Birth ambassador. And so what we do is, currently what I do specifically is, right now, every month I host a presentation where we talk about healthy births. Now, there are different parts where, like, let's just say, for example, for August, we focused on breastfeeding. And then before that, we focused on postpartum. But also, how do you pull your people together? How do you pull your congregation together? And so we help with all of that good stuff. And we're currently focusing on putting together just a roadmap to help pastors and to help ministers to figure that out. Because truthfully, most pastors in churches are males, so the most experience they have with childbirth is if they have a wife who's given birth, or an aunt or an uncle. So they don't, I'm sorry, I said an aunt or an uncle, or aunt or a niece. So sometimes they're really not just kind of up to date or fully understand.
Alicia, are you able to hear us?
So, I'm sorry, did I go out? I'm sorry. Okay. So just long story short, we're helping pastors, we're helping churches and congregations to understand how they can support. And so something as simple with your women's ministry, again, sponsor a Healthy Birth ambassador, because that's someone who is there within your congregation, who's hearing your preached word every Sunday, Wednesday, Thursday, Saturday, whatever day you guys gather. But then they're also able to support those families with scripture, because we know that divorce rates are extremely high. We know most of the time they say it's money, but then too, families go through a lot of changes when we've already gotten married now. So we have to put mom and dad's background together. So now we're adding like a whole baby into the mix, that's going to kind of pull on our history. So we have our mental history, we have our social history, we have financial, issues, health issues, and all of those things are going to come into play. So if you have someone, within your congregation that has been educated, that knows how to support these families, that, loves families, that loves God, that is hearing your word, all of these things will do wonderful, will be a tremendous asset, not just for the church, but even for the families that are within it. Because I know if my church family had not supported me through like my births, I don't know what we would do. And, just having those old mothers that are there within their church that are there to, encourage, and where they're putting meals together after delivery, all of that stuff, it helps. So, I mean, the church can do a lot. And so hopefully, through this Healthy Birth Louisiana initiative and the Healthy Birth Ambassadors, I mean, I think that this is a true game changer for families as a whole, for churches, for moms, for dads, just for the family as a unit. So I hope that answered the question.
Thank you so much, Miss Alicia. Dr. Megan, would you like to go ahead and give us your answer? How can faith-based organizations get involved and do a better job of impacting maternal health?
I think they can get involved by doing what's necessary. And so a lot of times, the pastors are male, but a lot of people in the church are female, right? And so a lot of people in the church do have babies and know what's necessary when you have a baby. And so one of the things that a lot of new moms lack is time. And so, if someone can volunteer to babysit so that mom can have time for herself, that might be something that's beneficial. A lack of time also means lack of time to do things around the house, a lack of time to grab food. And so, if the ministry can drop care packages or food off to the house, that would be beneficial for mom because that's one less thing that she has to do. Housework, errands. I mean, if you go over to visit mom and the baby, uh, if there's something that needs to be done, then volunteering. A lot of times people will ask what needs to be done, but it's rare that someone will exactly like tell you exactly what needs to be done. So if you anticipate a person's need, then jumping in and fulfilling that need might be beneficial. Also, a lot of times moms like to continue to feel connected, and so maybe something like a mother's Bible study or another way that moms can stay connected to other moms would be beneficial because that provides a sense of community, which a lot of moms sometimes feel like they lack whenever they're spending days on end with just the baby. So those are just some ways that the church can help and provide what things that may be necessary to new moms. Can y'all hear me or did I click out? Because all of y'all are frozen to me.
We hear you just fine.
Okay, all right.
Okay. Thank you so much for weighing in. Ms. Monks or Dr. Monks or Renee, would you guys like to weigh in on that?
I think all of the previously mentioned comments are excellent. I know that Dr. Bourne's recent comment of having some type of package for those moms who have recently delivered is a great strategy, having some type of care package for everyone who, no matter what the outcome of their pregnancy was, can receive that. We know, unfortunately, not every pregnancy results in a birth or a live birth. And so making sure that we're being equitable in terms of delivering services to mothers who have lost a baby or miscarried or whatever the situation is, I think having a care package is extremely important, and knowing what to expect and anticipate so that that mother does not have to ask. That would be a key component of a great support system because she won't have time or the executive function or cognitive capacity to know what's coming and how to support herself in that moment either. And so having support for those who are going through grief and loss is also super important. So I want to make sure we're keeping an eye out for that because we know that in the Black community, unfortunately, we have the highest rates, right, of everything across the board when it comes to negative outcomes. And so we have to also support those who might have a unique experience during that time.
Thank you, Ms. Renee. Super helpful information. Ms. Carey, the preemie mom coach, can you weigh in on how faith-based organizations can get better involved with maternal health?
Yeah, sure. So with me being a preemie mom, as my name goes with my organization, I've had 2 high-risk pregnancies, currently on my 3rd high-risk pregnancy. And I know the ways that the church has helped me by reaching out, offering words of encouragement, whether it be through scripture, through prayer, with my 2 NICU journeys that I've had with my children. That definitely helped when my daughter was going through surgery. You know, just having that extraness in my life at that point definitely helped me get through it. Like Ms. McKnight said, just setting up ministries and groups that bring people together so that we can share birth stories. We can have an open space to where we feel comfortable with, with just giving advice to each other, and just, my story can help somebody else, their story can help me. So being able to bounce off of each other, that's another thing that I find, is helpful. And hosting events that provide that maternal health education to families, and that includes men as well. The brothers, the cousins, everybody needs to know this information, because everybody should be team mom. And the more people who can help her out through this journey, that definitely gives her a better birth outcome at the end of the day. So helping the church just be educated with those things, it definitely benefits the mom in the long run. Just making sure that the members are knowledgeable about what's going on, and the resources and various types of help that's out there to support moms during their journey. Talk about breastfeeding, the importance of it, and things like that. And even relate those things towards stories in the Bible, where you hear about women who've had fertility issues and stuff, but then God blessed them and they were able to give birth. So just bringing it, surrounding it around with those stories and offering that encouragement and that hope, and just securing their faith. I believe that all of that just plays a part in a successful, happy teen mom for her birth story. One other thing I wrote down was just creating sessions that directly address the mental health needs of moms as well. With my traumatic birth, outcomes, that was definitely something that I would look forward to, joining a part of a session with some other faith-based women who can definitely just, relate to me on that aspect and hold my hand, and I can hold their hand and be able to talk about that type of stuff. So I feel like that's very important, and that's how churches can help out with supporting getting to positive birth outcomes.
I'd like to piggyback off Carrie, and also mention, Caitlin, that in the church community, sometimes certain topics are not typically spoken about because of cultural and historical norms and whatnot. And I really want to debunk the fact that we are living both within our church building and outside the church building too. So also having conversations around healthy lifestyles is super important for our teenagers, for our adolescents, for our college age students who may be going through unique situations in life, reproductive and whatnot. Having conversations around what it means to be a healthy female, a healthy male, and the interactions with their peers is also very important. And that's not typically discussed anymore in the church setting because of some historical cultural beliefs and whatnot. But it should be, because guess what? We are them and they are us. It's happening to our families and our children. And so having that protection around certain topics for health, overall health, is super, super important as well, because the church is such a great resource for all other education. So we need to make sure we're wrapping our services around full lifespan approach for all ages, but specifically for reproductive health in our women. It's super, super important.
Absolutely. I think you were right. You mentioned earlier that health across the lifespan does not begin at pregnancy or conception. Renee, you were talking about how important it is for us to be healthy across the board. And so like our organization, we really do focus on prevention. And so like most of the times, healthy children, healthy adolescents, become healthy, birthing moms and so on and so forth. That's really, really, really important. But I think you have to have like the tough, it shouldn't be a tough conversation to say to your congregation, hey, we're trying to, we don't want you guys to have heart attacks here. You know what I'm saying? In our congregation, we want, we don't want to have to come visit you in dialysis. You know what I'm saying? I know the church is in the neighborhood, 9 times out of 10, churches in the neighborhood, but there's no grocery store, but there's dialysis clinic. So let's talk about that. Let's talk about access. Let's talk about social determinants of health. Let's talk about how voting is a social determinant of health, right? And so we need you guys to vote. So, we need to get engaged in the process. So I think that that's really important that churches have, unconventional conversations around healthcare, not just healthcare, around access, around opportunity, around prevention, because, folks, we're dying more than everybody else. And that's the bottom line. So.
Absolutely. Thank y'all for weighing in on that. I'm going to go to you, Dr. Gross. But before I do, one thing I want to lift up, Ellen, something that you're kind of discussing is an easy way for pastors, faith leaders, faith organizers like myself to just kind of fill in the gap in the interim. Like, we're in a COVID-19 pandemic, unemployment is high, we're seeing all these other issues being exacerbated, including maternal health and mental health. And why not take that opportunity to take a Sunday sermon or a Bible study, or while we're handing out food during the Red Bean Mondays, as an opportunity to educate folks. Like, we don't have to go out of our way to have some huge festival or event to try and invite folks to the table. We can do it while they're already there. A lot of churches do have daycares. I know someone lifted up in the chat that she was kind of hesitant about sending her child to daycare just based on the nutrition or lack of nutritional options available for her. And so just taking moments like that to really state our demands, but then also tie in some of the other social justice issues that we're already working on seems like an easy way to get people at the table and then also meet them where they're at. And so, Dr. Gross, I'm going to toss it off to you, and you can finish out our conversation around how faith-based organizations impact maternal health.
Yeah, I think one of the things I know that we experienced was meal trains. Like, they kept sending us food when my wife was pregnant. When my wife gave birth to the kid, that the food kept coming. At times it was fried chicken, and at times it wasn't, but it was all good. Lord have mercy. But also, I think I will also add to that. I think even thinking of the Maxine firm, maybe churches can start hosting 5Ks. Or baby walks, like moms are walking with their babies, doing things like that. And it doesn't have to be to, bring light to, some traumatic situation, but it could be a walk to celebrate a mom giving life and that she's walking into motherhood. Maybe it could be walking to motherhood. That's yours. Y'all can have that. Just let me know when it happens. I want a t-shirt. But yeah, so I think things like that, that way the church can help. And I think also, as was mentioned earlier, there's a lot of times where the pastor is a man. So I think for him to defer to the woman of the church, for the lady of the church to say, hey, I got this, support me. So I think that will be one of those things where, again, we can complement and not be in competition with one another.
Absolutely. And as someone put that in the chat, that's a beautiful idea. All right, y'all, we're going to close out this segment of how faith-based organizations can get involved, but I do want to thank y'all so much for weighing in. At this time, I'm going to turn it over to Frankie, and she is going to get us through some probing questions that have been in the chat since the beginning of the webinar.
Thank you so much, Caitlin. Really, really appreciate you. And I appreciate just, again, everyone taking the time to just critically think about how our church, that plays such a huge role in our communities and health and well-being, mental health, which I say that, but that's a part of health. So if I don't spell it out, just know that mental health is a part of health. When you hear me talking about health, it's just so much that the churches are already doing, but just being able to identify ways that the church can address, our crisis that we're experiencing with our Black moms and our infants is just really a conversation that's long overdue. So I look forward to just continuing to work with each of you to just have this conversation continue and just to really hear from the community ideas and ways that we can engage with churches who deeply care about this as well. So Ayana, I am going to turn it back over to you to lift up some questions that we have in the chat. I know we have a question from one of our faves who managed to join us today, Nicole Deggins with Sista Midwife. So I'm going to turn it over to you.
Okay, great. Since you mentioned Ms. Diggins, I will go ahead and just start with that question. Was it? Actually, I apologize. I have them in order of how they were received. So let me just go from there. So the first question we had in chat was, how can we get connected to a healthy birth ambassador? Are there any financial or insurance requirements?
Okay, so there are multiple ways to get connected with the Healthy Birth Ambassador. And what I'm actually going to say is, if there's a specific like area or church that you're looking at, definitely send us an email. I also put that in the chat so that we can definitely discuss that into more detail. Now, we do offer, there are a lot of community events. One in particular, the Birth Story Project, where we gather all of this good information that I presented a little bit earlier on our call, where we talk about that, and then we figure out other ways and things that we can do to come back to help prevent these issues, or even to provide education and advocacy. So yes, and then we do have an area where there are some paid services that are available. So let me see. Did I answer all of that question? I'm sorry.
Yes,
So
I
you
think
can,
so.
okay.
But not to cut you off, feel free to continue.
And so we can also do a story, like where we come and share with you guys about our advocacy. We can do presentations there, and yeah. So I think that there's a lot that can be done. And so you can definitely email me at alicia@sistamidwife.com, programs, and then you can do programs at sistamidwife.com, or contact us. And so we'll be able to answer that on a more specific level. And if you want to add another question on top of there, go for it.
Yes, I'm seeing Nicole Deggins' question here about, Alicia, can you tell us how a church can get involved hosting a birth story project event?
Okay, so the same thing, you send us an email and we will get it going. We would love to host a birth story event anywhere, because it's so needed. It's needed to be able to have just that free and that open space to discuss things that, you know, may have happened to you that may have been positive or negative. Well, someone who is trying to get pregnant or who is currently pregnant, you know, they hear that information and we learn a lot through there. It also helps us to recognize what's going on, what we need to change, but then it also helps other moms to, you know, really and truly get prepared. So always, you can always send us an email. We'd love to have it. We'd love to come out and present, whether it is to a church or in a grocery store parking lot. We are ready and we are available.
I love it. I love it. All right, great. Thank you for that. Our next question is, as doulas, who would you refer a mom to if you think she is suffering from PPD, postpartum depression?
Okay, so as always, of course, as a doula, we are not practicing as medical professionals, right? So we would, of course, refer them back to their doctor, whether it be their midwife or if they are working with the OB. But then also we would refer to a mental health specialist, because we're more so that person that walks along with them. We support them through. We definitely have some education and knowledge about that, but postpartum depression is something that's very serious, you know? So we would refer to a specialist at that point. And I saw Dr. Bourne on here? She talked about it a little bit more. So yes, we would refer as a doula. We would not try to handle everything right there in front of that, because that's beyond our area of expertise. And we always want to make sure that we're doing the best that's for the family, that we're doing the best that's for the mom and for the baby.
Great. Thank you for that. And if anyone else on the panel would like to assist in the answer as well, of course, this is your time to share. And then I don't know if Dr. Bourne wants
Yeah, I'll
to
go
add
ahead.
anything.
I
Wonderful.
will. I'm glad that she said she would refer back to like a mental health provider or a primary care provider because that's what's suggested. And even when looking for a mental health provider, making sure that we're finding a provider who specializes in treating uh, mothers who have gone through postpartum depression or postpartum psychosis or any of the other things that typically develop after a mom has a baby. And so, not just finding any mental health provider, okay? Finding someone who specializes in treating postpartum depression is going to be essential.
That's very vital. Very, very vital. All right, our last question that I have from the chat is, well, I guess it's kind of a suggestion, but the participant said, what if the church did a baby-free day for moms? So I guess that's a possible suggestion of a way that faith-based institutions can be involved in this discussion. So great, great. I'll go ahead and hand it over to Frankie.
Thank you so much. And I like that baby free day. I think that, we have to support moms and dads and not feeling guilty about that. Just because you want to take advantage of a baby free day, that doesn't say anything about your parenting or your, love that you have for your children. Self-care is important. And sometimes you just need to clear your head, take a breather, just be responsible for yourself and your wellness. And, just you still have needs, you're still a person, and you can be the best person possible for your kids and your family if you are treating yourself the best that you can. So baby free day, as soon as COVID would allow, churches, yes, let's get that started. So I actually want to pose a few quick questions to some of our panelists. I think this conversation has just been so rich. I want to first start off with Dr. Bourne-Kilbert. I talk a lot about mental health, and I've worked with you quite often on a few projects and with several mental health professionals from the Maxine firm. And we like to talk about mental health. Our goal is to destigmatize mental health, normalize conversations on mental health. Can you please just talk to us about how, as a church or faith-based institutions or the community as a whole, how do we destigmatize mental health in the Black community?
Well, in the Black community, I definitely would say that there is stigma attached to mental health. We already know this, right? But I always say you can't heal what you don't talk about. And so, if nobody's talking about it, then there is no way that we can actually come together and figure out what are the best resources in order to be able to heal. Um, when we look at it from a numbers perspective as a provider, we know that at least 20% of people experience mental health concerns. And I say at least, the reason I say at least is because a lot of people don't talk about what they're going through. And so I would imagine that this number is higher than 20%, but um, the numbers now reflect 20%. And so we'll go with 20%. But if you look at that, that's still 1 out of 5. And so, what that tells us is that a lot of people are experiencing mental health concerns at some point in their life. If you look at the lifespan, if you look at how long you've lived, at some point there's been something to happen that will probably change your mood or, you know, show like change the way that you behave. And so we go through things. That's my point. We all go through things at some time or another. But if we don't talk about it, if we feel like we're alone in the fight or in the journey, then there's nothing that we can do about it. And so I applaud churches and faith based organizations that really bring mental health concerns to the pulpit. I applaud churches and mental health organizations that have counselors on site. Um, because that indicates that the church is not against mental health treatment. You know, a lot of people sometimes feel like it's all or nothing. Either I'm all into church and all in the Bible, um, or I'm not doing something good enough. I don't need a mental health provider. It's just if I'm in my word enough, then I should be okay. And I like to tell people that these two things aren't mutually exclusive. Like, you don't have to do one and not do the other. You can do both. The more support and the more resources that you can have are going to be beneficial to getting you to the place that you need to be. And so I applaud churches and congregations that continue to talk about it, continue to normalize it, because that's what we need. If we're not talking about it, then we won't be able to heal from it.
I totally agree. And I appreciate that comment. One of the things that I think most people on this call know about me is that I've been very transparent in sharing my journey after my daughter Zoe was born preterm, and how I dealt with postpartum anxiety and even post-traumatic stress disorder that was pretty much a result of, my traumatic birth and then her hospitalization. She spent almost 2 months, and it was just, just the uncertainty of that, and that not being what we expected, and literally not just really having your hands tied. It's a lot that parents go through that the average person, unless you've been in that environment, you don't understand. So I have vowed to talk about that, to try to normalize that. And it wasn't something that I arrived at lightly. I was concerned, I was embarrassed, but I said, if I don't talk about it, then others won't. And then the next mom that's in that experience is totally caught off guard about what could happen to them. And then the cycle continues. And we're talking about people's lives, people's livelihoods, people's marriages, people's relationships, things like that, that can all be impacted by untreated, issues that are very common. So we have to talk about it and normalize it. So thank you for everything that you are doing. I'll pose one rapid fire question to you, and then I have one for Carrie. But we can't even pretend like there's not this massive grind culture. And as Renee shared with Marcia Dons earlier, weathering is a big deal for Black and brown bodies from societal stressors. But then we're just having to prove ourselves more, work more to get, to a basic point. And there's just a lot coming at us. How do we change the culture and radically engage in self-care in an environment that just tells you just keep going and beat yourself down, until you don't have anything left? And literally people wear that like a badge of honor. Like, how do we change that?
The question's for me.
Oh, yes.
Okay. All right. Okay. I think we're getting to the point where we're changing it. I feel like at this point, a lot of people are talking about self-care and the importance of self-care. And I think it's important to distinguish the difference between self-care and being selfish. And so when we think about being selfish, it's not the same as self-care. Self-care is literally getting some time in where you can recharge your batteries, your mental health, so that you can be the best you. We already know that it's really hard to be the best us for other people in our lives if we can't do that for ourselves. Like, you can't pour from an empty tank. And so self-care is really being able to recharge your batteries. That doesn't mean that it has to go on. It doesn't mean that you get a baby free day or you get a day without doing anything that requires responsibility. It can be that, but that's not what it is. Self-care can be something as simple as taking 30 minutes to exercise. And that's not something that you have to do baby free. You can go walk in the park. Like the uh, example Dr. Gross gave about doing the mom thing with the babies, like, that's exercise, that's engaging in self-care. So anything to improve yourself for your mental health is self-care. That could be something as simple as getting a cup of coffee that you enjoy. That could be something as simple as taking a hot bubble bath for 20 minutes. It doesn't necessarily mean engaging in selfish activity, but I do want the grind culture to chill out, because what we do know is that, we can't be Kevin Gates. 6 jobs don't get tired. No, all right, because you might not get tired, but you might send yourself into an early grave, because we know that sleep is important. It's our body's way of repairing itself. We know that rest and relaxation is important. All of these things are important for our health, not just our mental health, but for our health. And so to continue to go on days and days within, I don't need to sleep. I'll sleep when I'm dead. No, no, that's not healthy. Okay. And so recognizing that you can still get things accomplished, yet still take time for rest, is important. Even Jesus rested. So we know that rest is important.
Okay. I think somebody just, that is true. Even Jesus rested. So amen. I'm actually going to pose a question. Thank you, Dr. Bourne Kilbert, to Carrie. And then we're going to close out with Ellen. And I see that Renee typed some things in the chat. I appreciate those resources. And I do want to call your attention to the bottom of the chat where Renee has shared some resources on how to get some more information from marchofdimes.com about a toolkit called Beyond Labels, and then also our mental health link on our website that has a lot of great advocacy resources. So please take a moment and take a look at that. Carrie, Miss Pregnant Mama, I'm coming to you right now. And we're going to ask you to take a minute to answer this question. What advice do you have for moms for self-advocacy and healing from a traumatic birth experience?
So from a self-advocacy perspective, recognize what's important to you. You know, things that everyone on your team, on Team Mom, understand. You need to make sure that everybody is aligning with your ultimate goal here. My ultimate goal with my third pregnancy is a full-term birth. So if you're not talking full-term birth to me, I don't need you talking to me at all. You can, you know, be removed from my Team Carrie, my Team Mom, you know, birth plan. But you are a part of your care team. So think of yourself as a partner with them, not just the patient. You're the core of what they do. You're the reason why, you know, they're at work, because they're caring for patients. So you're definitely a part of that care team, and think of yourself definitely as a partner who goes hand in hand with them in making the decisions about what your outcome will be, what you desire your outcome will be, right? So from a traumatic birth perspective, being that I've endured 2 of them, don't be so hard on yourself. Don't judge yourself. Don't blame yourself. You know, we do that a lot. We're trying to analyze, you know, where did I go wrong and what happened and all that stuff. And I don't know if y'all hear these babies back there screaming, but I'm just like, you know, I beat myself up so bad about my first preterm birth, which was at 29 weeks to 1 pounder. And then I learned after that, after years of trying to heal and recover mentally from that it wasn't my fault. It was, you know, it was in God's plan to get me to where I am right now, to be able to help other moms who are going through that trauma. Also, you know, just seeking the support and positivity from your church members, from your family, from anybody who's in your circle, your friends, that will help to keep your mind just clear and clear the negativity that could come in there from any direction. The devil is real, so be ready for it in any situation. I found what Dr. Kilbert was saying, right? When she talked about the depression and all of that type of stuff. Well, I went through that. I went through PTS, you know, post-traumatic depression after that, with both of those kids. And I was just, you know, torn apart after that. But thankfully, with just support, like from my friends, from Frankie, just the March of Dimes, everybody, you know, I knew that it was just no way that I should hinder myself from my desire, which was to have another little one. This is my 29-weeker right here, trying to join and give y'all some advice. But I have a 31-weeker back there, and now I'm going for my full-term pregnancy right now. So I'm just braving the elements of what I went through and just learning from, stop, girl, and just learning from all of that so I can get to this point. So I'm as pregnant as I've ever been before at 33 weeks tomorrow. And that, you know, that's just how you can overcome trauma and things like that. So don't let a medical professional or someone be, you know, the reason why you're not going to go head on and pray yourself to your successful outcome that you want. Stop it, child.
All right, Carrie, you are so awesome. And we could give you your own segment, but we can also hop on Instagram Live and support your own segment. So I want to ask everybody to take a moment and put your Instagram, your social media channels in the chat. We're about to wrap it up and take it on home and go back to church, y'all, while we close this out. But I just want to thank everyone here for joining. I want to ask Ellen if you could put the information in there. I know you had some great info about some of the symposiums that the Maxine firm has done with churches. That has really been phenomenal. If you can type in maybe a link to your website or something, while Ayana gives us our good old time music to take us home. But I just want to thank everyone. Caitlin, moderating today, doing a great job as usual. Power Coalition for partnering, Sista Midwife Productions for partnering, Department of Children's and Family Services, Pew Charitable Trust Governor's Office on Women's Policy, and Department of Health for Louisiana for sponsoring this, and for support from Kellogg Truth and Racial Healing for making this possible. So y'all, this has been great conversation. Thank y'all so much. We will continue to impact Black maternal health. Thank you to our speakers. And we will see you next time. Ayana, take us on home, please. Take us to church.
Thank you.